Prostate-Specific Antigen, Clinical Applications in Prostate Cancer Detection. PSA testing has become a cornerstone of prostate cancer screening, though its clinical utility remains subject to ongoing debate regarding benefits and potential harms of early detection. Understanding prostate-specific antigen, molecular basis and function. Prostate-specific antigen, commonly referred to as PSA, represents a glycoprotein enzyme with significant clinical relevance in oncology and urology. This molecule is produced by a gene called KLK3, which belongs to a larger family of genes responsible for producing kallikrein-related peptidase enzymes. These proteins are typically secreted by epithelial cells within the prostate gland itself, though emerging evidence suggests similar production may occur in periurethral glands in women, a finding that broadens our understanding of PSA's distribution throughout the body. The enzyme functions as part of the prostate's normal physiology, participating in the liquefaction of semen and maintaining the health of prostatic tissue. However, when abnormal cellular growth occurs within the prostate, PSA levels in the bloodstream can increase significantly, making it a valuable diagnostic marker. The discovery and evolution of PSA as a cancer marker. The identification of PSA revolutionized how clinicians approach prostate cancer detection and has remained a central component of screening protocols for several decades. Since its introduction into clinical practice, PSA testing has enabled earlier identification of prostate malignancies in many cases, contributing to increased detection rates and earlier intervention in symptomatic and asymptomatic populations. The widespread adoption of PSA screening fundamentally changed the epidemiology of prostate cancer diagnosis, shifting the detection of disease earlier in its natural history. This technological advancement came with the promise of improved outcomes through early intervention, though subsequent clinical experience and rigorous research have revealed a more nuanced picture regarding the true benefits and potential drawbacks of widespread screening. Clinical applications and screening protocols. PSA testing serves multiple clinical purposes in the context of prostate health and cancer management. In asymptomatic populations, PSA measurements are frequently used as part of opportunistic or organized screening programs, particularly targeting men within specific age ranges considered at higher risk for developing clinically significant disease. In patients presenting with symptoms suggestive of prostate pathology, such as urinary frequency, hesitancy, or nocturia, PSA measurement helps differentiate between benign prostatic hyperplasia and potentially malignant processes. Additionally, in men already diagnosed with prostate cancer, serial PSA measurements serve as critical tools for monitoring disease progression, assessing treatment response to therapeutic interventions, and detecting recurrence following initial treatment completion. Interpretation of PSA values and clinical thresholds. Key points: baseline PSA levels typically range from 0 to 4 nanograms per milliliter, though some clinical guidelines now recommend age-adjusted reference ranges. PSA velocity, the rate of change of PSA over time, provides additional prognostic information beyond absolute values alone. Age-specific thresholds acknowledge that PSA naturally increases with advancing age, reducing false positive findings in older men. Free versus bound PSA ratios can help distinguish benign from malignant elevations, improving diagnostic specificity. Benefits of PSA-based screening programs. Proponents of PSA screening emphasize several potential advantages of implementing systematic testing strategies. Early detection through PSA measurement can identify aggressive malignancies at earlier stages when curative treatment options remain feasible, potentially improving survival outcomes for men with dangerous variants of the disease. The non-invasive nature of blood testing makes PSA screening accessible and acceptable to large populations, requiring minimal patient burden compared to more invasive diagnostic procedures. By identifying men at higher risk, PSA testing facilitates more targeted investigation and resource allocation, focusing intensive interventions on individuals most likely to benefit from aggressive management. Furthermore, the availability of reliable PSA data allows clinicians to implement active surveillance strategies, enabling careful monitoring of low-risk cancers without immediate intervention. Limitations and potential harms of PSA screening. Despite its widespread use, PSA testing carries substantial limitations that clinicians and patients must carefully consider. The antigen lacks perfect specificity for malignancy, as elevations occur not only in prostate cancer but also in benign conditions including prostatitis and benign prostatic hyperplasia, leading to unnecessary anxiety and further investigation in many men. The limited positive predictive value of PSA means that many screening-detected elevations ultimately represent false alarms, requiring additional diagnostic procedures such as biopsies that carry their own morbidity. Perhaps most concerning, PSA screening can detect indolent malignancies that would never have caused clinical harm during a man's lifetime, leading to overdiagnosis and subsequent overtreatment with associated complications including incontinence, erectile dysfunction, and radiation or surgical risks. Distinguishing clinically significant from indolent disease. A fundamental challenge in PSA-based screening involves differentiating truly dangerous cancers requiring aggressive intervention from slowly growing lesions unlikely to cause mortality. This distinction proves crucial because not all detected cancers warrant immediate treatment, yet the initial PSA elevation cannot reliably predict which cancers will remain indolent. Modern clinical approaches increasingly incorporate additional molecular and imaging biomarkers alongside PSA to refine risk assessment, including genomic testing, magnetic resonance imaging, and advanced imaging modalities. Risk calculators incorporating multiple variables including PSA level, age, family history, and digital rectal examination findings help guide clinical decision-making. This multifaceted approach aims to preserve the benefits of early detection while minimizing unnecessary interventions in men harboring low-risk disease. Current guidelines and recommendations for PSA testing. Major medical organizations have refined their recommendations regarding PSA screening in response to emerging evidence and the understanding of screening benefits and harms. Contemporary guidelines typically recommend shared decision-making between patients and clinicians, ensuring that individuals understand both the potential benefits and real risks before electing to undergo screening. Most authorities recommend targeted screening approaches in higher-risk populations, such as men with significant family histories of prostate cancer or African American men who demonstrate higher disease incidence. Age-stratified approaches reflecting changing disease prevalence across the lifespan inform screening intervals and testing frequency. Rather than universal, routine screening, current best practices emphasize individualized decision-making that accounts for patient preferences, comorbidities, life expectancy, and specific risk factors. PSA monitoring and treatment response assessment. Beyond its screening applications, PSA measurement remains invaluable for managing men already diagnosed with prostate cancer. Serial PSA measurements after primary treatment with surgery, radiation, or hormonal therapy provide objective evidence of treatment efficacy and early warning signs of recurrent disease. Rising PSA levels following initial treatment completion prompt investigation for biochemical recurrence, potentially representing the earliest detectable sign of treatment failure before clinical symptoms or imaging abnormalities become apparent. The PSA doubling time, the interval required for PSA to double, carries prognostic significance, with rapid doubling suggesting more aggressive disease biology. These monitoring strategies enable clinicians to identify candidates for salvage therapies or alternative approaches at the earliest possible point in recurrence trajectory, potentially improving long-term outcomes. Future directions and emerging biomarker strategies. The limitations of conventional PSA testing have spurred considerable research into complementary and alternative biomarker strategies that might improve diagnostic accuracy and predictive value. Refined molecular approaches examining PSA isoforms, derivatives, and protein structure show promise in enhancing specificity for malignancy compared to total PSA measurement. Genomic testing platforms analyzing circulating tumor DNA and RNA offer potential advantages in risk stratification and treatment planning. Imaging biomarkers including multiparametric MRI provide structural and functional information complementary to PSA values. Integration of artificial intelligence and machine learning algorithms incorporating PSA alongside numerous other clinical variables may enhance prediction accuracy for identifying men most likely to benefit from intervention. These emerging approaches represent the direction of precision oncology, moving beyond single marker-based decision-making toward comprehensive risk assessment incorporating multiple complementary information sources. Patient counseling and informed decision-making. Optimal clinical practice regarding PSA screening demands thorough patient education and informed consent processes that acknowledge the nuanced benefits and harms inherent to testing. Clinicians must communicate the test's limitations transparently, explaining that elevated PSA does not confirm cancer diagnosis and that detected cancers may not require immediate treatment. Discussions should address the potential for false positive results leading to anxiety-provoking investigations, the possibility of unnecessary biopsies, and the risk of overtreatment for indolent disease. Conversely, counseling must acknowledge the real potential benefit of early detection in certain subpopulations at higher risk for aggressive disease. Shared decision-making frameworks that respect individual values and preferences regarding testing yield more ethically sound outcomes than paternalistic approaches imposing screening universally. Effective communication about PSA screening represents an essential component of patient-centered care in modern oncology. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.